ask Raul to leave the studio, and we'd also like you to maybe ask your children to leave the room as well. I don't know. It depends. Like, I wouldn't even ask my son to leave the room talking about this. It's time for a little adult talk. Parents, you know, when you have the kids and all that, it gets even more difficult with it all. But Dr. Irwin Goldstein, the Director of Sexual Medicine at Alvarado Hospital, is here to talk about a new study that just came out in the journal about sleep and sex.
Our favorite journal.
What is the article about? And what does it mean?
Actually, this is a historic article. It's the first time. It's so weird that it is the first time. But we have never had studies on sleep time, sleep quality, and female sexual functioning. So we need to do these research studies. So finally, this was done. 171
college-age women participated in
University of Michigan, God bless them.
What did you find, or they find?
So let's take a few steps back. So there's, it's about 10% of the population in the US has what's called chronic insomnia. So these are people who don't get the correct amount of sleep. 1/3 of your life is supposed to be on the bed asleep. It's supposed to be,
but don't get me started on this. Because I know a lot of us, we hardly get enough sleep as it is, and it makes it worse to think about, oh, there's going to be more problems if we don't get enough sleep.
Let me go through this and I'll get back to your problem, okay? So the thing is, you need sleep. It's 1/3 of your life is supposed to be in sleep. So you get problems if you don't sleep. You get memory loss, you have functional impairment, more motor vehicle accidents, irritable, nervousness. There's heart disease associated with this issue. So,
gosh, I don't remember my next question. No, I'm just kidding. Go ahead.
Oh, that's so fun. Okay. So you want to be aware of explanations for women who have sexual problems. We're the sexual medicine doctors. So if there's something we can resolve that's easy,
but you have
to
know what the problem is first. And so this study found.
So this study said that if you have a longer duration of sleep, you have better arousal the next day and better desire the next day. In fact, if you have an extra hour of sleep, 14% better opportunity for having partnered-related sexual activity. So it's very positive things about sleep. So that's important for us as healthcare providers. So if a woman comes in and says, gee, I have no interest, gee, I'm not aroused.
That's a question you could be
asking. We could now introduce this concept. So we need more research, but we now have an avenue to say, gee, tell me about your sleep issues, and let's see what we can do to work on it.
What surprised you about this study?
What's surprising about this study was we haven't done research on this topic. So there's male, of course, research, because conditions that are associated with heart disease, often associated with blood flow problems, which lead, of course, to erection problems through the blood flow issues.
Okay, so what did you tell me earlier? We were talking earlier about if you got way too much sleep.
Oh yeah, so there's a quirk to this, very interesting. In general, the more you sleep, the better your sexual function. But in specific, if you have a long night's sleep, let's say 12 hours sleep, for whatever reason, the next day it's difficult to get aroused.
What is that
about? I don't
about?
even know that. I think you need to be adrenalinized to be aroused, and maybe you're just too relaxed from having too much sleep.
Or it could be like anything in physics, you know, an equal and opposite pendulum swing. If you get too little or too much, it's the same equal distance from zero.
Right? But the point in general, what we're trying to talk about today is women have sexual problems. We want to resolve them. We want them to have better quality of life.
I love
so we need to find avenues to help women. Gosh, if we can find this as their avenue, that would be fabulous, and that's the point.
So talk to your doctor about it. For more information, go to our website, fox5sandiego.com, and click on the Scene On button. And as usual, thank you for all that you do for women.
I really appreciate
you really take a stand. Dr. Goldstein really takes a stand for women and medicine, so I appreciate that very much.
In August, we're going to hear if this is the year of the woman, 2015, from the FDA.
How so?
So the drug that's we don't have a drug approved for women, but there's a drug now there at the FDA, and in August the vote will be made to see if it's approved. We will have to do a special show on this if this comes through.
For sure.
Yes.
Dr. Goldstein, thank you very much. Okay, Erica, back over to you.